This video is only for educational purposes, no any clinical treatments, shall rely solely on the basis of knowledge from this video. More than happy for the gaps to be fulfilled with correction for mistakes and laggings.
So let's start the TNM classification of the oral cancer. So while starting the TNM classification of the oral cancer, we'll look after the tumor size, which is T, and then after we look at the lymph node involvement, and then after we look at the metastasis present or not. Well, there is, if there is presence of metastasis or not. So this will define the TNM, and that on that basis we'll divide the classification of the stages of the oral cancer or the cancer of the tongue in the 1, 2, 3, 4 grading. So we'll grade in the stage 1, stage 2, stage 3 and stage 4. So rather than stages, we'll grade stage 1, stage 2, stage 3 and stage 4. Okay, so starting the tumor size, we'll see the T1, T2, T3 and T4, the size of the tumor. And to make it to make it more complicated on the basis of the size less than 2 centimeter and between the 4 centimeter and less than 2 centimeter, less than 1 centimeter, I have made the simplified version so that it can be easy and it will not cause a problem in the classification of the tumor size. So if you see that the size of the tumor is about the 2 centimeter, and the depth of indentation, and if then we see if there is a depth of invasion is less than 0.5 centimeter, then that will be the T1. If that is the size is, if the size is less than, if the diameter of the ulcer is like the tumor, or the diameter of the ulcer or the tumor is about 2 centimeter, and the depth of invasion is 0.5 centimeter, then it will be the T1. And if it is about the size, it's less than or equals to 4 centimeter, and the depth of invasion is less than or equals to 1 centimeter, then it will be the T2. And if it is more than 4 centimeter, and if it is more than depth of invasion is more than 1 centimeter, then it will be the T3. And to make it in the T4, we'll see the moderate advanced tumor or the severely advanced tumor. That means that it has involved, if it has involved the oral cavity and if it has involved the lips, then I will say that it is in the stage 4A, and if it has involved the base of the skull, then it will be severely advanced, and that will be the 4B. So T1, 2 centimeter, 4 centimeter, 4 centimeter is the landmark, 2 centimeter. So if it is less than 2 centimeter, if it is more than 2 centimeter, and if it is less than 0.5 centimeter, it will be T1. If it is more than 4 centimeter, and if the depth of invasion is about less than 1 centimeter, then it will be the T2. And if the tumor size is about more than 4 centimeter, and if it is less, and it is more than 1 centimeter of invasion, then it will be the T3. And in the T4, that will be more than 4 centimeter, more than 1 centimeter, but that will be the advanced. That it will involve, if it involves only up to the oral cavity and up to the lips, then it will be moderately advanced. It will be the T4A. And if it has involved the base of the skull, then it will be the 4V. Now starting on the nodal size, node involvement, if there is no lymph node involvement, then it will be the N not 0, no involvement of node. And if it has involved less than 3 centimeters single on the ipsilateral side, then it will be the N1. And if it has, and to make it just simple, there are so many things that will come under the consideration of the N2, but to make it simple, whether it is multiple or the single, but the thing is that if it is less than 6 centimeter, whether it is single or multiple, and or it is less than 6 centimeter but more than 3 centimeter, then it will be on the N2. And if it is more than 6 centimeter, then it will be N3, to make it more simpler. And to see the metastasis, if it is involved metastasis or no metastasis. So these are the things that will come under the T and M. And to make the grading, there will be the T1 and not M not. This will be the stage 1. T2 and not M not. It will be the stage 2. T3 and not M not. It will be the stage 3. And if it is T4, then it will be the T4 and not M not. So these are the things very easy. T1 and not M not, T2 and not M not, T3 and not M not, T4 and not M not. This is 1, 2, 3, 4. But if it involves the any T1 and any below that is T3, T1 or T2 or T3 with nodal 1, nodal 2, nodal 3, but no M not, it will be stage 3. This is very important if it has N1 up to the T4. But if the N1 is present here and it is T4, it will be the T4. Okay. So if any involves N1, and if nodal is involved, then that will start from the stage 3. This will not be 1, 2, 3. If this has a T1 of size, nodal 1, if any of the nodal is involved, it will be start from either it will be stage 3 or either it will be stage 4. There is no chance that it will be of the stage 2. Okay. And if it has the involvement, and if the node is less than 6 centimeter, that is 3 to 6 centimeter, then it will be obviously stage 4. and it will depends whether it will be A or B or C. And if it is node, lymph node has been involved, and it is about less than 3 centimeters, it will obviously be the 3, and chance is likely to be 4 if the tumor size is up to the T4. So T4 N not M not T4 N1 M not. So this will be the stage 4A. And if any of the tumor, any size T1, T2, T3, T4, with the size of Tn with the nodal involvement of N2, that means if the size is less 3 to 6 cm, sorry, if the size is less than 6 cm, that is 3 to 6 centimeter, it will be the 4 if any of the nodal involvement. But if any of the tumor size T1, T2, T3, T4, any tumor size with the lymph node more than 6 centimeter will be 4B, and if any tumor size of less lymph node less to 3 to 6 centimeter will be 4A. But no metastasis. Okay? If there is metastasis, be it any tumor size, be it any nodal involvement, it will be the C, 4C. Okay, if this comes metastasis, do not look for any T size, any nodal involvement. If this has been metastasized, then it will be the grade of 4C. Okay, to make the gist, if there is metastasis positive, then it will be the 4C. And then after in the other stage, we'll just avoid the metastasis, so we'll just concentrate on the T and N. And if that node, and if you see the lymph node of more than 6 centimeter, then it will be the 4B. And if the lymph node is between 3 to 6 centimeter, then it will be the 4A. And if that lymph node is less than 3 centimeter, and there is advanced stage of the tumor size, that means it has involved the lips, it has involved the oral cavity, and it has involved the base of the skull and the pterygoid, and it is less than 3 centimeter, then it will be the 4A. But there is no any advancement of the tumor size. It has not involved the oral cavity, lips, and just it is more than 4 centimeter, and the depth is more than 1 centimeter, and there is lymph node involvement, and the lymph node involvement is also less than 3 centimeter, then it will be the 3. But always be cautious that if the lymph node is involved, then that will not be any chance that it will be of stage 1 and stage 2. Okay, and the next is very simple: T1, T2, T3, T4 with no nodal involvement, no metastasis, will be corresponding to 1, 2, 3, 4 stages. So this is the gist.